My name is Joshua Hyman. I'm the Associate Medical Director at the Weinberg Family Cerebral Palsy Center at Columbia University Medical Center. If your child has cerebral palsy, there's a good chance that he or she will have a hip x-ray. I'd like to talk with you about some of the components of the x-ray that you as their parent should be aware of and can look at. The first thing to look at in a hip x-ray is the relationship between the femoral head and the acetabulum. Think of the femoral head as the ball of the ball and socket joint. The acetabulum is the socket. The femoral head should be seated deeply within the acetabulum. In some children with cerebral palsy, it can slowly begin to come out of joint, and in some children it can be out completely. The second thing to look at is the shape of the femur. The femur is made up of three parts: the femoral head, the femoral neck, and the femoral shaft. And there should be a slight bend to it. In children with cerebral palsy, they have a tendency to develop a straight femur. As a result, the femoral head can grow out of the acetabulum and eventually dislocate. Also, while this is happening, the shape of the acetabulum can become affected. The third thing to look at is the acetabulum itself. The acetabulum should have a horizontal roof to it. This keeps the femoral head in place. If the femoral head is pushing excessively against it, the acetabulum can change its shape and become more oblique, and as a result, the femoral head can slowly slide out of place. As a parent, you want to know as much as you can about your child's health. As a parent of a child with cerebral palsy, this becomes perhaps even more important. I hope this information helps you to better understand the issues around your child's hip health and allows you to have a thorough conversation with your doctor about the options available to your child.